Welcome, everyone. My name is Jessica Shiles, and I am a genetic counselor at Fulgent Genetics. The purpose of this webinar is to help you learn more about common hereditary cancer syndromes and how genetic testing can benefit your patients. We will start out with a brief overview of cancer. According to the World Health Organization, there are over 18 million new cases of cancer diagnosis every year, and it is the second leading cause of death worldwide. There are a handful of factors that can increase one's risk to developing cancer over time and can include diet, exposure, natural aging, or even one's genetic makeup. What exactly is cancer? Cancer is a name for a group of related conditions where cells in one's body grow uncontrollably, eventually leading to a tumor and possible malignancy. We are all born with many genes that are responsible for protecting us from cancer by regulating normal cell growth. But some individuals may inherit a genetic change that can significantly increase their risk to developing cancer. As mentioned, cancer can be due to different causes. Most of the time, cancer happens by chance or at random. We refer to this as sporadic cancer. Cancer can also be seen more frequently in a family and may be due to genes and/or shared environment and lifestyle factors. However, 5 to 10% of the time, cancers are due to inherited genetic changes that are considered hereditary. These changes are inherited from our parents and can also be passed down to our children. When reviewing a patient's personal and family history, some of the signs suggestive of hereditary cancer include multiple relatives with the same or related cancers, cancer diagnosed at a very young age, several primary cancers, for instance, breast cancer and small cell lung cancer, or rare cancers such as ovarian cancer, pancreatic cancer, or male breast cancer. If there is a suspicion of hereditary cancer, the risk can be detected by genetic testing of associated genes. Several genes associated with an increased cancer risk can be analyzed to determine one's individual risk to developing cancer. Different genes will contribute to different cancers. A mutation in any one of several genes may result in one or multiple types of cancer. For example, a mutation in BRCA1, TP53, or BRCA2 can indicate an increased risk to developing ovarian or breast cancer. In cases of mutations in these associated genes, genetic testing can be beneficial to your patients. Benefits of genetic testing include establishing or confirming a diagnosis, providing clarity to a case, identifying individual risk for developing certain cancers and/or other health conditions, defining optimal treatment and management plans for your patient based on their risks, such as increased surveillance and monitoring, risk-reducing surgeries, preventative medications, and lifestyle adjustments to avoid additional risk factors. And last but not least, helping identify at-risk family members who may also be at a 50% risk of inheriting the same genetic mutation. At Fulgent, we believe that early detection helps patients be more proactive about their health, which is why we offer genetic testing for over 15 types of cancer to help guide medical management for patients and their families. Our cancer product lines are flexible in providing a wide array of genetic tests suitable to accommodate the unique needs of each patient, which is why we offer several testing options including focused panels and comprehensive panels. Our comprehensive panels look at 127 genes known to be associated with hereditary cancer. These genes include high and moderate risk genes that have been well studied, as well as newly discovered genes. Although thorough, this option may yield results that have conflicting interpretation and uncertainty. Because of this, some clients may prefer our focused panels. Focused panels target a subset of genes most commonly associated with only high and moderate risk of developing hereditary cancer syndromes. Narrowing focus decreases the uncertainty and results mentioned previously. Within our cancer product line, we also have preset and custom panels. You can order from our preset panels, which are designed based on cancer types. We also provide the option of custom panels, in which you can add on or delete any genes on our list to accommodate the unique needs of your patients. Our cancer product lines are guaranteed to analyze up to 99% of the coding regions at a minimum of 50 times to ensure quality and consistency. Sequencing is completed using next-generation sequencing in addition to methods such as Sanger, qPCR, or MLPA to confirm sequencing results. Our quick turnaround time puts results into your hands within 2 to 3 weeks. You also have the option to request a test be run stat, which provides results in approximately 10 days. Deletion and duplication analysis can guarantee thorough analysis at a resolution of 1 exon or greater, and if necessary, we can also perform a single exon analysis when requested. In certain genes, some complex genetic alterations may require additional analysis, in which we use complements such as MLPA to assess. Overall, our testing is robust and accurate to ensure quality results to you and your patient. As mentioned before, we test for over 127 cancer-related genes, which are distributed amongst our panel options. Our preset panels include some of the most common hereditary cancer syndromes, including hereditary breast and ovarian cancer, as well as colon cancer. Other cancers, such as endometrial cancer or prostate cancer, also have their own unique panels. Additionally, Fulgent provides a full cancer panel option that aims to capture the most common hereditary cancer syndromes in one test. With all these options, you may be questioning which test might be optimal for your patient. We recognize each case is unique and warrants further consideration, and we are here to help guide you to what testing options might be the best fit for your patient. Comprehensive testing is commonly ordered for patients who want to know all possible associated risks. This can include individuals or families with a history of hereditary cancer syndromes with complex presentations. Patients in these situations can also choose to limit uncertainty and include only stronger associated genes, in which case our focus panel may be more preferable. Preset panels, again, are designed to target specific hereditary cancers and can be either focused or comprehensive. When a family history is indicative of a certain hereditary cancer syndrome, say ovarian cancer, considerations of preset ovarian cancer panel could be recommended. Or, for a family history of different hereditary cancers, a full cancer panel might be more applicable. Our process is also flexible and custom panels can be designed to match the patient's clinical indications or concerns. For example, your patient may have a personal or family history of colon cancer and lung cancer. With Fulgent custom panels, you have the option to include genes associated with lung cancer in addition to the genes on the preset colon cancer panel. Another option might be to remove particular genes from a preset panel. If you have questions, our team of genetic counselors are available to help select the most appropriate test to fit your patient's needs. After discussing these options and agreeing on a suitable panel, your patient should be consented to proceed with the testing process. A Fulgent test requisition form will be provided to complete and a sample will be collected from your patient. Acceptable specimens include saliva, blood, buccal swabs, and extracted DNA samples. Tumor tissue is not an acceptable specimen, and another sample type will be requested if sent. The sample will then be sent to our laboratories, where genetic material will be extracted from these samples upon receipt, and will undergo various processes depending on the genes involved. The data gathered will be further analyzed by our expert team of bioinformaticians and curation scientists to generate a report. Results will be sent to you, the provider, for further discussion with your patient. In any questions or concerns regarding the testing ordered, our team of genetic counselors will be available for inquiries and can also provide direct phone counseling for your patients. Fulgent's comprehensive reports include clear reporting of all variants detected per request of the provider or patient, interpretation of cancer risk with the associated gene variants, a summary of the associated cancer and follow-up management recommendations, if available, followed by variant-specific details summarizing the molecular interpretation of your patient's results. Genetic test results can yield one of three outcomes. a positive result, a negative result, or a variant of uncertain significance. A negative result implies there were no changes or mutations identified in the genes that were tested for. However, this does not guarantee that an individual will never develop cancer in their lifetime. A positive result indicates that a mutation was identified in one or more of the genes tested for. This result can sometimes confirm a diagnosis in patients who have a personal history of the cancer tested for, or it can simply indicate an increased risk to developing cancer. With a positive result, medical management can sometimes be tailored to the patient's particular genetic risk. For cancer-specific management recommendations, more information can be found through the guidelines established by the National Comprehensive Cancer Network. The third possible outcome of genetic test results is known as a variant of uncertain significance, also referred to as a VUS. VUS results indicate that a genetic change was found. However, there is insufficient data at this time to know whether or not the change identified causes an increased risk of cancer. This type of result is fairly common, and a majority of these changes are benign and do not impact an individual's health. Results are typically treated as negative, and medical management should continue to be based on the personal or family history of your patient. In summary, hereditary cancer is prevalent in the general population, and at Fulgent, we pride ourselves in offering a comprehensive menu to meet the unique needs of your patients. With 99% guaranteed coverage on all 127 hereditary cancer genes, Fulgent's reliable test results can assist in confirming a diagnosis, helping identify cancer and health risks, to help guide treatment and management, as well as identifying at-risk family members who can also benefit from testing. Overall, early detection is important for your patient's health, and at Fulgent, we are here to help provide you and your patient with the power of knowing and the option of doing. Thank you. And to learn more, please visit fulgentgenetics.com.